We will discuss the distribution process of pharmacokinetics. After the absorption process is done, the drugs are now already in the bloodstream. Then, these drugs should spread to other parts of the body, and this process is called distribution. The drug distribution varies on different factors. First of all, the solubility of antibiotics differs their distribution ability. Hydrophilic antibiotics are highly soluble in water and have a smaller volume of distribution. They are effective for infections in the bloodstream and urinary tract, but they have limited penetration to lipid-rich tissue like brain. Examples of hydrophilic antibiotics are beta-lactams and aminoglycosides. Lipophilic antibiotics are highly soluble in lipid and have larger volume of distribution. Therefore, they have good penetration into lipid-rich tissue, which makes them effective in treating CNS infections. The examples of lipophilic antibiotics are macrolides and fluoroquinolone. Blood flow also influences drug distribution. Some organs such as brain, liver and kidney receive more blood than others, and it means that the drugs are distributed more to them. Conversely, some tissues have less blood flow like skin and adipose tissue, and the drug distribution to them will be less.
The drug distribution is influenced by the capillary permeability. The more increasing the permeability, the more the drug is distributed. The sinusoidal capillary and fenestrated capillary have open pores and enhance permeability. It allows better distribution of the drug to the tissue. Kidney, intestine, liver and spleen are composed of those capillaries. The continuous capillary junctions are too tight and prevents to enter the drugs into them easily. It can be found in blood-brain barrier and skeletal muscle. To achieve good penetration to those areas, high lipophilic with small molecule drugs should be administered. Another important factor is protein binding. Drugs in the bloodstream exist in two forms. Bound form means that the drug binds to plasma protein, particularly to albumin, and another form is unbound or free form. Only the unbound fraction is pharmacologically active and can distribute to the tissues. Antibiotics with high affinity for plasma proteins such as ceftriaxone, doxycycline, clindamycin are less free form and less distribution. However, protein-bound antibiotics acts as reservoir, releasing the drugs slowly into the bloodstream. This can prolong the drug's half-life and provide a sustained therapeutic effect. Liver produces albumin, and they are prevented by kidneys from excretion. In patient with liver disease, albumin production will be less and plasma albumin level also will be reduced. It leads more free drug in plasma available and more tissue distribution and high chance of toxicity. Similarly, patient with chronic kidney impairment cannot prevent leakage of albumin, which leads the less plasma albumin and high free drug levels in plasma, high tissue distribution and high risk of toxicity. Therefore, dose adjustment is necessary for those type of patient. The volume of distribution is a key pharmacokinetic parameter that determines how extensively a drug is distributed throughout the body. It is defined as the volume in which the amount of drug would need to be uniformly distributed. The higher the volume of distribution, the more the drug is distributed to the tissues. Volume of distribution is influenced by drug solubility, molecular size of drug, blood flow and protein binding. Lipophilic drug like glycopeptides, small size of drug like fluoroquinolone, high blood flow organ like brain, and low protein binding affinity drugs like fluoroquinolone have higher volume of distribution. The drug distribution is changed in shock patients. In hypovolemic shock patient, the blood flow is poor and it decreases the drug distribution. In septic shock patient, the capillary permeability is increased and it allows leakage of antibiotics from the blood, as well as the plasma drug concentration will be reduced. Therefore, higher dose of antibiotics should be administered. Understanding the drug distribution can benefit us in antimicrobial stewardship, such as in choosing the appropriate antibiotics and in adjusting the dosage of antibiotics to reach a therapeutic effect and to minimize the side effect. Thank you.